Musculoskeletal questions 1. A nurse is planning measures to increase bed mobility for a client in skeletal leg traction. Which of the following items would the nurse consider to be most helpful for this client? 1. Television. 2. Reading materials. 3. Overhead traps. 4. Fracture bedpan. The correct answer is 3. Overhead traps. 2. A client is being discharged to home after application of a plaster leg cast. The nurse would evaluate that the client understands proper care of the cast if the client states that he or she should 1. Avoid getting the cast wet. 2. Use of fingertips to lift and move the leg. 3. Cover the casted leg with warm blankets. 4. Use a padded coat hanger. N. To scratch under the cast. The correct answer is 1. Avoid getting the cast wet. 3. A nurse is evaluating goal achievement for a client is traction with impaired physical mobility. The nurse would evaluate that the client has not successfully met all of the goals formulated if which one of the following outcomes is noted. 1. Negative human signs. 2. Active range of motions of uninvolved joints. 3. Intact skin surfaces. 4. Bowel movement every 4 hours. The correct answer is 4. Bowel movement every 4 hours. 4. A client being measured for crutches asks the nurse why the crutches cannot rest up under the arm. For extra support, the nurse response is based on the understanding that this could result in 1. Impaired range of motion while the client ambulates. 2. Skin breakdown in the area of the axilla. 3. Injury to the brachial pulsus nerves. 4. A fall and further injury. The correct answer is 3. Injury to the brachial pulsus nerves. 5. A nurse is obtaining a health history from a client and is assessing for risk factor associated with osteoporosis. Which of the following assessment finding is not an associated high risk factor? 1. High calcium diet consumption. 2. Postmenopausal age. 3. Long term use of corticosteroids. 4. Family history of osteoporosis. The correct answer is 1. High calcium diet consumption. 6. A nurse is planning to teach a client how to stand on crutches. The nurse plans to incorporate into written instruction that the client should be told to place the crutches. 1. 8 inches to the front and side of the client's toes. 2. 3 inches to the front and side of the client's toes. 3. 20 inches to the front and the side of the client's toes. 4. 15 inches to the front and side of the client's toes. The correct answer is 1. 8 inches to the front and side of the client's toes. 7. A client is providing instruction to a client with osteoporosis about appropriate food items to include in the diet. Which of the following food items would provide the least amount of calcium? 1. Plain yogurt. 2. Seafood. 3. Sardines. 4. Pork. The correct answer is 4. Pork. 8. A nurse has given clients instruction about crutch safety. The nurse evaluates that the client needs reinforcement of information. If the client states 1. The need to have spare crutches and tip available. 2. The crutch tips will not slip even when wet. 3. Not the use someone else's crutches. 4. That crutch tips should be inspected periodically for wear. The correct answer is 2. That crutch tips will not slip even when wet.